Welcome, welcome, everybody. We'll just ask everyone to mute yourselves. We're going to give everybody another minute or two to log in, so make yourselves comfortable. Feel free to use the chat box to say hello and tell us where you're signing in from. And then this is the ATS boot camp, resident boot camp, trainee boot camp workshop for PFTs. Give everybody one more minute and then I'll do the introduction before we take it away. All right, so it is 4:03 right coast time, 1:03 left coast time. So my name is Laura Crotty Alexander. I'm at UCSD and it's my pleasure to welcome you to the ATS virtual version of the Resident Boot Camp. We were really sad not to offer this program in person this year, but we're excited to be able to offer this virtual version today. So our leader of this session is Dr. Tristan Huie from Colorado. If you want to find all the other workshops, this is the website to go to, wiki.thoracic.org with the resident username and ATS Camp password. So there you'll find the other workshops, including ventilation management, which happened last week, and it has been recorded. We did ECMO last week as well. We did the ICU emergencies, and ARDS best practice was just an hour ago, and then we have another version on Friday at 3 p.m. if you'd like to register for that. Finally, we have a respiratory failure and sort of closing ceremonies next week that we'd love to have you sign up and join us for. This wouldn't be possible without the Resident Boot Camp chairs, Dr. Narav Shah and Dr. Matt Drake, and our entire Resident Boot Camp team. Especially big shout outs to the ATS staff who did a lot of hard work pulling this together. Another thing that you might be interested in joining is the ATS COVID Critical Care Training Forum. It occurs every Tuesday evening at 8 p.m. Eastern Time. And we already have 11 episodes banked on the site for free, covering all kinds of topics related to COVID critical care. But today we're focused on PFTs and Dr. Huie is going to lead us. We do recommend that you do turn on your video in the breakout rooms in particular so you can interact with your facilitator. You can ask questions out loud. You can post questions in the chat box. Your facilitator, if they have a preference, will let you know. And we have a lot of wonderful teachers with us today to help guide this session. So a big thank you to you all for joining us. And with that, I'll pass the mic to Dr. Huie to take it away.
Thanks, Laura. I'm going to share this. So what we're going to do today is going to be similar to what we have done in resident boot camps in the past. And the purpose of what we're doing here is to help you guys think about starting fellowship and thinking about PFTs. Our primary goals here are to allay anxiety related to starting fellowship. And so having just a rough idea and looking like you know what you may be doing when you're reading PFTs will be the main goal here today. We will review some of the resources that are available online to you, but we're going to spend the majority of the time just reading PFTs. And so the structure of today's session is that I'm going to do basically a 3 to 4 minute overview of what my approach is, and then we're going to break up straight into the rooms where we've got 8 selected cases that you'll work through with your small groups and with a facilitator. And then feel free to ask questions and seek guidance there. But I think the best way to learn PFTs are just to practice with PFTs. There are resources that many of you have probably taken advantage of already. So at the ATS Wiki website, there's a video from last year that goes into a little bit of depth of why we do PFTs, an overview of what's being measured with the different elements of the PFT, and then goes through some examples. And you can watch that video. The sound quality is a little challenging for the first couple of minutes, and then it gets better. There are also the online teaching material that we used in person, which has some diagrams and then about 20 cases. And the cases that we're working through today are selected from that group. And so just as an overview to what you're doing with PFTs, the first thing you're going to want to do is to look and see the demographics of the case that you're looking at. That includes the age, the sex, the body habitus, because all of these are things that will impact what's normal. You can talk a bit about how we get normals in your small group. The next step is to look at the comments from the technician who was administering the test. And what we're looking for here is a sense of whether that data is useful and repeatable. And there are criteria for both the spirometry, the lung volumes, and the diffusing capacity that determine whether it is acceptable and useful data that's repeatable. Next, I like to look at the spirometry pattern and determine whether there's obstruction or if it suggests a restrictive pattern. Next, you'll look to see if there's a bronchodilator response. And then you'll look to lung volumes and characterize those as normal, obstructed, or increased, either hyperinflation or air trapping. And then we'll look to assess what the diffusing capacity looks like. And depending on why you're doing these PFTs, you'll grade the severity, you'll compare them to prior PFTs if those are available, and you'll apply that to your decision making. With that, we're going to dive straight in. I'd like to thank all of my colleagues from the University of Colorado and National Jewish, both faculty and fellows, who are going to help be the facilitators for these small groups. And we'll jump right into the small groups.
All right, just give me one more minute to double check that I put the facilitators in all the right groups. And it looks good. And when you get the option to move into your group, just go ahead and say okay. And I might be adding a couple people as we go, but have fun. I hope you learn a lot, and we'll hopefully see you at the next workshop.